So I want you guys to watch this next video. It's from one of our top partners that has a fantastic Medicare lead program. So if you're currently writing Medicare and you really want to go to that next level, their system has worked for hundreds of agents across the country, and we're bringing it to you. Watch it, let us know your questions, and this might be your next big thing.
As an insurance advisor, you face many challenges getting access to the resources you need to be successful, especially if you're an independent advisor. Most advisors' needs will change as their business grows, and eventually, marketing will become your biggest hurdle to a six-figure practice. Gordon marketing agents have access to a turnkey, proven marketing system that targets prospects approaching their initial Medicare enrollment. You can expect to be introduced to 20 to 30 new Medicare prospects a month with our program. All marketing and materials are done for you. All you need to do is show up and present to a room full of prospects. Our team creates each agent a company-branded presentation deck, marketing pieces, and a landing page that will reflect your company and branding. Each agent also gets a client-facing monthly newsletter to help support and grow their book of business. Lastly, and one of the best aspects of the program, is the ongoing coaching and mentoring sessions with successful agents in the program. If you think you're ready to start marketing for Medicare, but you don't know where to start, let us save you time and money with our proven marketing program.
Medicare expanded mental health coverage because so many seniors are battling depression and anxiety and loneliness and problems in their marriage, apparently. So now, for the first time, family therapists, marriage therapists, and family counselors can get approved as Medicare-approved providers, which is kind of interesting. So it'd still be a 20% copay, depending on what type of insurance you have. But it's something to talk to your clients more about because it's one of the secret illnesses that's not evident and that people are still very stigmatized, especially older people are very stigmatized about. So it's something to make them aware of the services that are available because in most cases, they really weren't available in the past. When you're talking about mental health services, let's talk about psychiatrists. That is one of the weak points with Medicare Advantage. The number of psychiatrists in most networks is pretty slim. And it's hard to get into a psychiatrist anyway, so they don't have to accept Medicare patients, right? Where they get much lower reimbursement. So you can see why this is a problem that's not going to get better. But it's something to alert your clients to. Networks is something you're always talking about when you're going through their list of providers and you're like, yeah, all your providers are accepted by this plan. Make sure you're always doing that CYA, cover your assets. I cleaned it up. You're always doing your CYA to say they're in the plan now. That can change at any time. They have the ability to go out of network. We have no idea to know when their contracts expire. So if you're talking about a Medicare Advantage psychiatrist, don't let them buy this plan hinging on the fact that they can see their psychiatrist, and they might not be able to see their psychiatrist later, so just make sure you explain that. If you're just with original Medicare, you're cool. If you have any questions, ask me in the comments below. Tune in again next week. Thanks.